chromosomal abnormalities can either be numerical or structural. So a major condition that we should know about is Down syndrome, i.e. trisomy 21 most of the time. And this is the most common cause of severe learning disability. So risk factors include advanced maternal age. Well, the major risk factor is that, in fact. So features include decreased tone, flat facial profile, protruding tongue, prominent epicampal folds, and cardiac problems. And you may also note that in their hands they have a single simian crease, a single palmar crease. And also a gap between the first and second toes. So diagnosis of Down syndrome is primarily based on the clinical examination and the mother's medical history, but genetic testing can confirm diagnosis or establish whether there is in fact a chromosomal translocation. And what I mean by that can be explained more or less by this picture, whereby you can often get a Robertsonian translocation. So take some time to look at that, or pause. And then, okay, right. So also you may want to do an ECG to check for structural defects, or an EKG to check for any cardiac conduction abnormalities. So often, well, actually, probably in most cases, it is diagnosed via amniocentesis or chorionic villus sampling whilst in the womb. Okay, so moving on to other chromosomal abnormalities. We have Edwards syndrome. So Edwards syndrome is common, but not as common as Down syndrome, and essentially is trisomy 18 or a translocation. And so in terms of pregnancy, you might find polyhydramnios, and comorbidities that occur as a result of Edwards syndrome are congenital heart disease, and they can have several obvious physical abnormalities. So diagnosis, again, ultrasound, amniocentesis, chromosomal analysis. So trisomy 13 is less common than the above. I believe that's Patel's syndrome, and it's less common than trisomy 21 and trisomy 18. And there are also comorbidities which are very similar to have very similar findings to Edwards syndrome, and are discovered in the same way. So another chromosomal abnormality that you can get is Turner syndrome. So that's 45X, as in there's a deletion of one of the X chromosomes, or a deletion of the short arm of one X. So these children, or these people, are essentially female, but they're lacking either a whole X or part of the X. Over 95% of these cases result in early miscarriage. So the most common cause of primary it's the most common cause of primary amenorrhea, and the children tend to be infertile, but they still have a uterus. So you have comorbidities such as cardiac problems, and Turner syndrome is associated with coarctation of the aorta, and renal dysfunction and diabetes and other things. Okay, so presentation, amenorrhea, they have a short stature, they're quite obvious with them, they have a webbed neck. And on physical examination, you may find uterus, well, you should find a uterus, coarctation of the aorta, you could have a low hairline in the back, low set ears, hypertension, thyroid dysfunction. Diagnosis is primary clinical, and they're treated with growth hormone therapy, estrogen replacement for development of secondary sexual characteristics. And then we have Klinefelter, which affects chromosome 47, and it's 47XXY. So we have an extra X in a male. So obviously what would that lead to? So symptoms would include signs would include breast development and puberty, decreased intelligence, infertility, female physical characteristics, but they're male. So the diagnosis is seldom made before puberty. But if you do a testicular biopsy, you'll find Leydig cell hyperplasia. And also you can find an increase in gonadotrophins and a decrease in testosterone. So management is testosterone replacement. Therapeutic management include educational interventions, physical, speech, behavioural, family therapy, and the prognosis is good.